It's time to transform your health with one of North Carolina's leading authorities on true health. Over the next 30 minutes, you'll learn how to prevent and reverse disease, overcome common health issues, and live to your fullest God-given potential. This is True Health Radio with your host, Dr. Jake Shuppe of Freedom Family Chiropractic.
Welcome, everybody, to another episode of True Health Radio. Your host here, Dr. Jake Shuppe. And this week's topic is chiropractic and weight loss. This time of year, people are often getting really focused on their weight. Here's one of the reasons. Not only are a lot of Americans overweight, in fact, 63% of American adults are overweight. And about a third, about 33% of adults are considered to be obese. So this is a problem all across the country all year round. But what happens this time of year? You've got the holidays. And so basically from Thanksgiving, maybe you can relate here, from Thanksgiving through Christmas, even to New Year's, you've got holiday parties, you've got family get-togethers. You had that huge Thanksgiving dinner, cookies, sweets, traditional foods that your family, and people really lose track of their health. And they're not only eating poorly, but not moving around, not getting the exercise that they need, which is one big thing that plays into weight loss. But today, I'm going to be talking about how absolutely chiropractic care is specifically related to weight loss, losing weight, and weight loss resistance. And chiropractic adjustments can promote weight loss in a couple of different ways. I'm going to be diving into 3 ways, and there's a couple more, but today we're going to focus on 3 ways about how spinal health influences weight loss. So take note of this, write this down, remember this. Poor spinal health leads to weight loss resistance. I'll say that again. Poor spinal health absolutely leads to weight loss resistance. So this gets overlooked big time. This really gets overlooked by a lot of the health experts or weight loss experts, gets overlooked by your medical doctor, nutritionists, trainers, weight loss strategists, about spinal health playing a major role in your weight loss and building lean muscle and can lead to weight loss resistance. So the 3 things that we're going to look at today, first topic is how spinal problems can cause pain, which will lead to you not exercising and gaining weight. The second topic is how this poor spinal health can affect your hormones and weight loss. The key to weight loss is hormones. The third topic is how subluxation or these spinal misalignments can affect your sleep through just having pain and not sleeping, also affecting your sleep hormones as well. And this does affect your weight. So those are the 3 topics that we're going to be going into. And I'll say that you could do everything right with nutrition and exercise and supplementation and still not be seeing the results that you're looking for if you have a spinal problem. Now, most of you out there, most Americans are not doing the exercise and the nutrition right, so we got to work on those. But even if you were, you have to address the spine if you want to be at your ideal weight and ideal overall body function. So let's dive into the first topic, how subluxation or these spinal misalignments, they can cause pain. Maybe you're having back pain, neck pain, radiating pain down your arms or your legs, and this pain from like a pinched nerve or nerve system interference is limiting your exercise. Maybe you can relate right now where you've got weight to lose, and maybe even your doctor has said, hey, you need to lose some weight, and you're frustrated because every time you start a new workout program or every time you start to try to walk or exercise or run, you injure yourself or it causes a severe, I'm not just talking about soreness. I mean, when you exercise, you're supposed to be sore when you're starting off. That's not an excuse, but when you're legitimately in severe pain or re-injuring yourself because you're trying to lose weight. So that can be really frustrating. And it's this vicious cycle of you can't lose weight because you're in pain, and it just goes around and around. Well, I got a story that I want to share with you guys, and I hope this encourages somebody and really you can relate with it. So this lady came into the office, and she was about 60, 65 years old. I met her out at a health screening, and she'd really been struggling with her weight. And one of her big goals was to increase mobility and just being able to get around because the pain was affecting her mobility. And she had back pain, hip pain. She was struggling with knee pain. Well, she came into the office, and I did a full spine exam, and she was having problems, so I took x-rays, and I found that she lost 37% of the normal curvature in her lower back. So almost 40% of the curve in her lower back was gone, and that was it was pinching the nerves. It was causing pain in her lower back. It was traveling down her hips and her legs. I said, hey, this is what's causing your pain right now. And she starts getting adjusted. And less than 60 days later, her lower back pain is completely gone. Her knee pain improved 50%, and she was able to get around better. Her mobility started increasing. She had way more energy because when you're in pain, that can really zap your energy. So she had more energy, and she lost 26 pounds because she just started being able to move around and being more mobile again. She didn't even start a workout program, but just because she was out of pain and she had more energy and she did more things around the house and was able to walk around more, she was able to start losing weight and get on the right track. Not to mention her blood pressure is now normal and she's down 26 pounds. So if you're in pain and it's limiting your ability to move around or walk or exercise and you want to lose weight this year, give me a call, schedule an appointment to come into the office, and I'll help you out. I'll meet with you. You'll get a full spine exam, consult, plus any necessary x-rays. And normally that first appointment's $110, but if you call right now, it's going to save you $50. It'll just be $60 for that whole first appointment, and we'll start working on a natural solution of how you can start losing weight and hitting your goals this year. So that number, give me a call right now. It's 984-444-8952. You can call me or text me on that number. And if you get the voicemail, leave your name, leave your number. I'll call you right back and I'll answer any questions and help you find a time for that first appointment. I'll give you that number again. It's 984-444-8952. Or you can check us out online at freedomfamilychiro.com. We've also got some great recipes and testimonials online. Or if you want to schedule that appointment online, you can do that at freedomfamilychiro.com. So it's clear that pain because of spinal subluxation or poor spinal health will limit your exercise. And when you're not moving around as much, you're going to gain weight. And that's really clear. The other topic that I want to go into today, this is one that really gets overshadowed, really doesn't get talked about. So I mentioned at the beginning, medical doctors, nutritionists, weight loss strategists, they overlook this. And here's one thing I'm really excited about, because I mentioned that the key to weight loss is hormones. And in fact, so much so that you could actually, if your hormones are balanced, if you get all your hormones right, that's more important than exercising on a regular basis, because that's how big of a deal hormones are to your weight loss. And I'm not an advocate of being sedentary. I'm not an advocate of just sitting around, but I'll tell you, this is how important your hormones are. So get this. Chiropractic adjustments, I mean, they rarely receive recognition for their ability to assist in weight loss, but chiropractic adjustments directly change body chemistry, specifically your hormones. And hormones are proven to be a major factor in helping men and women, both, everybody, to lose weight. And there's tons of science behind this, because when there is a misalignment in your spine, these spinal subluxations, it causes interference in your nervous system, and it causes stress hormones to be released. So these stress hormones, like one of them being cortisol, it increases these stress hormones, and that causes you to hold on to body weight, hold on to body fat, and it decreases your growth hormones to help build lean muscle mass. And here's why. Especially in the neck, the subluxations in the spine, the spine directly interacts with a part of the brain called the hypothalamus. And the hypothalamus controls all the major hormones, including the ones that deal with weight loss and muscle gain. So if you have subluxation or spinal restriction or interference, it's going to affect your hypothalamus. It's going to throw off the balance of your hormones and cause weight gain and not be able to build lean muscle mass the way that you want to. And this is a thing that doesn't get talked about on a regular basis. So this is why people can exercise and eat good and hit major plateaus. This is why you can exercise and eat good and just not lose the weight that you want to. And you're working hard. And if you're frustrated, you have to look at the spine if you want to get to your ideal weight and really have overall health. This is another reason why, I mentioned how you can exercise and eat right and not lose the weight that you want to. On the other side of the story, though, this is why I see people, poor spinal health or these subluxations, throwing off your hormones. This is why a guy can come into the office. Like, here's a story of a patient that came into the office. I was doing my internship in Colorado, in the Denver area, a few years back. And he came into the office. This guy was like 100 pounds overweight. And he came in, got the testing done, had a terrible spine. And I knew that it was affecting the nerves going into his thyroid, affecting that upper area near the hypothalamus. So I said, this is leading to some of your weight loss resistance. And we told him he needed to start eating better and start exercising, but he didn't want to listen to us on that, right? So he's like, I'll get adjusted, but I'm not doing any of this other stuff. We're like, okay, at least start getting adjusted. So he starts getting adjusted, loses 50 pounds without changing his eating or exercising, because his poor spinal health was throwing off of his hormones so much. Well, after he starts shedding all the weight, starts losing 50 pounds, he finally starts realizing that we knew what we were talking about. So then he starts coming to the workshops and starts learning some of the nutrition and exercise stuff that we're teaching. And then he loses a bunch more weight. And so he's down, not quite, but almost 100 pounds. But the first 50 he lost without doing anything, because his poor spinal health was affecting his hormones and causing weight loss resistance. So if you want to kickstart your weight loss this year, feel better, have more energy, look better, give us a call and schedule your first appointment to come into the office. I'll be the doctor meeting with you. And here's what we'll do. You'll get a full spine exam, consult, plus any necessary x-rays to see if your spinal health is affecting your ability to lose weight. And normally that first appointment's $110, but if you call right now, it's going to save you $50. It'll just be $60 for that whole first appointment, and we'll start working on a solution that's going to help you hit your goals this year. So here's the number. Give me a call right now, It's 984-444-8952. You can call or text that number. We'll set up a time that'll work for you. Here's the number again. It's 984-444-8952. And if you get the voicemail, I'll call you right back and answer any questions and get you set up. You can also check us out online on our website at freedomfamilychiro.com. We've got some awesome recipes and testimonials on there as well. So yeah, I mean, that's just such a cool thing, I think, of how your spinal health directly affects your hormones and your ability to lose weight, because like I said, it's just not something that gets talked about often enough. And that's why we're on here spreading these principles of true health and healing and getting this information into people's hands that you just need to know about. Spinal health is a missing link to not only weight loss, but a lot of other health issues. The other topic that I want to go into today, the third topic of how your spinal health affects weight loss and building lean muscle mass, is how subluxation or spinal misalignment can cause pain, which can affect your sleep. And sleep is a big thing when it comes to weight loss. So there's actually two ways that I can talk about sleep right here in causing weight loss, because you can have spinal problems that can cause pain that affects sleep. But the second aspect of it that I'm going to talk about is how this spinal misalignment can also throw off your sleep hormones. Not just like weight loss and muscle building hormones, but also can throw off your sleep hormones. But first, let's talk about how pain can affect your sleep. So let's say you've had a spinal problem, neck pain, back pain, numbness and tingling. Well, when you go to bed at night, can you relate with this? You can't get comfortable. It's painful, so you're tossing and you're turning and you're trying to sleep in every position possible, and you just can't get comfortable. You maybe get, if you're lucky, a couple hours of sleep at a time before you're tossing and turning or have to get up, and then you get out of bed and you're not refreshed in the morning, and this pain is causing some major sleep issues. Well, how do you feel in the morning when you wake up? Are you refreshed and full of energy? Probably not. And not only that, so let me ask you this. If you are not sleeping well and you have pain and then you're having low energy, what's the likelihood of you working out on a regular basis? Not very good. So that can lead to you not getting the exercise you need. But also, when you don't sleep well, this also releases more stress hormones. And one of them I talked about already, but when you don't sleep well, your cortisol levels go through the roof. That's your stress hormones. And that will also cause you to not be able to lose weight. It causes your body to hold on to body fat and can lead to weight loss resistance, all because your back pain is not letting you sleep, and your lack of sleep is not only weakening your immune system, but it's causing you to gain weight. Well, that's one way that poor spinal health can cause you to gain weight, is because you're not sleeping good. And it's frustrating to not sleep good. Well, here's another way that poor spinal health can lead to weight gain through sleeping problems, is that I mentioned the hypothalamus before. And so this upper part of the neck, this spine, it influences the brain. Well, very near to those, the hypothalamus that produces your weight loss hormones and hormones that regulate your metabolism, is very close to the area that regulates your sleep cycle and your sleep hormones. So if you have a misalignment in your neck or restriction in the bones in your spine and your upper neck, that influences your sleep cycle and your sleep hormones. And I want to share a story I have a guy who came into the office with this type of an issue. His name's Jimmy. He's been a great patient in the office for a couple of years now. And Jimmy came in with sleeping issues. And he wasn't having a lot of pain, so it wasn't like the pain was keeping him up at night. He just couldn't fall asleep. And Jimmy was only sleeping like 3 to 4 hours a night. Not very much at all, like less than half of what you're supposed to be getting, like about 3 hours a night. Comes in, we do the testing. He had restriction in his spine, so we got x-rays taken. And what I found was when I reviewed the x-rays is that Jimmy had lost over 100% of the curvature in his neck. And that is not good. Your spine is supposed to have a 45-degree curvature when you look at your spine on an x-ray. The side view of your neck should have a nice flowing curvature in it. And his was not only straight, it was starting to reverse the opposite way. And why that's such a big problem is it starts stretching and pulling on your spinal cord. And it narrows the circumference, or it narrows the diameter of your spinal cord, and it starts pulling down on your brainstem. And that's the area that controls a lot of different things, including your sleep cycle and including your sleep hormones. And so I told Jimmy, I said, hey, you're not sleeping good. And one of the big reasons is because you've lost 100% of the curvature in your neck, and it's affecting your sleep cycle. And a lot of people don't think about their spine causing a sleep issue. Well, he was having low energy, and because of his low energy and not sleeping good and throwing off his sleep hormones and his metabolism hormones, he was gaining weight. Well, he comes in, he starts getting his spine adjusted, and in about 60 days, well, actually it was his first progress evaluation, about 4 weeks in, he starts sleeping better. So he goes from 3 to 4 hours a night to 6 to 7 hours a night. And then about 60 days into it, he's sleeping 8 hours a night on a regular basis all the way through the night. So he's getting like double the amount of sleep. So he's getting really excited because he's sleeping better. And now because he's sleeping better, he has more energy. And that encourages him to start working out on a regular basis again. So Jimmy's sleeping better. He's got more energy. He's working out. And get this, he's lost between 15 and 20 pounds, all because he's now sleeping better and has more energy and is able to do some of the things that he wants to do. So if you're not sleeping good, if you want to sleep better, if you want to have more energy, if you want to lose weight this year, give me a call and schedule your first appointment to come into the office. I'll meet with you, and on that first appointment, you'll get a full spine exam, consult, plus any necessary x-rays. And typically that first appointment's $110, but if you call right now, it's going to save you $50. It'll just be $60 for that whole first appointment, and we'll help you start developing a plan to hit your weight loss goals and really getting healthier this year. And here's the number. Give me a call right now to schedule your appointment. It's 984-444-8952. You can call or text that number. It's 984-444-8952. You can also check us out online at freedomfamilychiro.com. And I want to mention that we do high-level corrective chiropractic care in our office. But the other thing is, just by becoming a patient in our office and receiving chiropractic care, here's just some of the extra bonuses that you get by becoming a patient. Is you have full access to me through phone or email at any time to answer any health questions that you have. And I will give you cutting edge nutrition information. Also, I will give you the most scientifically proven effective ways to exercise and specifically target those hormones to lose weight. And that doesn't matter if you're an Olympic athlete or if you've never worked out in 50 years or if you've had back surgery or hip surgery. I have exercises that are intermediate, beginner, advanced, where you can start somewhere, and as little as 12 minutes of exercise a day will help you start hitting your weight loss goals. And once you start feeling better and get your spine in proper alignment, then you can work out on a healthy spine and not have to suffer severe pain, so you can actually really hit your weight loss goals this year instead of just stopping and starting and going backwards and trying that vicious cycle all over again. So just by being a patient, I'm going to give you cutting-edge nutrition information, the most effective types of exercise to be able to do safely to really hit your health goals this year. And we do free work. We do educational workshops where we literally break down nutrition, what to eat, when to eat, how to eat it. How you schedule your meals throughout the day makes a big deal in hitting your weight loss goals. So this is a comprehensive, true healthcare system. Yes, we do some of the best chiropractic care in the country in our office, but you're going to get so much more than what you pay for with nutrition and fitness thrown right into it, and really get to the root cause of your problems and help you have the healthiest year yet. So if you want to get healthier this year, give us a call, schedule your first appointment to come into the office, and I'll meet with you. You'll get a full spine exam, consult, plus any necessary x-rays. And normally that first appointment is $110, but if you call right now, it's going to save you $50. It'll just be $60 for that whole first appointment, and I'll meet with you. We'll start developing a solution to help you hit your health goals this year. Here's the number. It's 984-444-8952. You can call or text, and you can also check us out online at freedomfamilychiro.com. And I'll talk to you guys next week.
Thanks for listening to True Health Radio with Dr. Jake Shuppe of Freedom Family Chiropractic. Call to schedule your appointment now at 984-444-8952. That's 984-444-8952.